So I'm Francisco Abecasis. I come from Lisbon, Portugal, and I'm a PICU consultant. And I'm also the head of the ECMO program at my hospital, neonatal and pediatric ECMO program. So we started the pediatric ECMO back in 2010. At the same time, we started the transport program. So it was actually natural that we mixed the two, and we started doing ECMO transportation 1 year after that. So we've been doing it for the past 15 years. We are not a very large volume center, but we do cases every year, 10 to 12 cases a year. And so we've accumulated some experience with more than 100 patients, pediatric and neonatal patients over these years. And we love what we do. Simulation, it's a very good way because we don't have many cases, and this is a very technical and complex technique. So if you don't train beforehand, everything that can go wrong probably will go wrong with real patients. So if you do a lot of simulation and you practice and learn from each other, from the mistakes one has done, then when faced with real problems, you'll be much more comfortable in solving them, much more quicker. And for the safety of the patient and also of the team, I think simulation should be mandatory in this kind of technique. Well, if you can train as a team, doing teamwork in simulation, you will know the procedure better. You'll be able to practice and troubleshoot some things that might go wrong. And when they happen in real life, you'll be able to solve it faster. But also, if you know what can go wrong, that's the most important part. You can prevent those things from happening. So if you already practice all this and you know what can go wrong in real life, you'll try to prevent the same mistakes or pitfalls from happening. And that is obviously a good thing for the patient and for the safety of the patient, because if you know, for example, that your oxygen cylinder can empty and you are on top of that, it will not empty and you don't have that problem with the patient. So I think it's really very important. Well, obviously there are some things that are similar, doing with the environment we're working in, the ambulance, or the helicopter or the plane. But pediatrics have some characteristics that make it unique. For example, to protect from the cold. It's very, very fast that a newborn, for example, can get really cold in the outside in transport. Adults tolerate that a bit more. So in some situations, children are more susceptible to some adverse events than adults, and so you have to be extra careful. But of course, there is a part in the transport that's similar to both age groups, and you can train both. But you have to pay attention to these particularities of children. Well, I was actually very impressed because it was a high-fidelity simulator that could actually make the scenarios very, very realistic. So we could almost don't speak with the students, and I would just follow the scenario with what was happening with the mannequin that was really on an ECMO machine, on a real ECMO machine, and we could simulate a lot of things. One of the problems with advanced simulation is that sometimes, from my experience, it gets so complicated that you end up not using it. And what I found different in this case is, even though it could make a lot of things, we could use most of those things just with a very short learning curve. So yesterday we were not very comfortable using it, and today we did a much more complex scenario. And actually the software helped a lot doing it, because we could save the scenario and then it would be really easy to change it. And we only known it for a couple of days. So if we get to know the simulation and the software better, I think it has amazing capabilities and turns complex stuff into more simple ones, and so that you can really use in the practice. So I like it very much. I think it was the fact that you could obviously put on the ECMO machine, but you can change things like the pressures, venous obstruction, artery obstruction. You could feel the pulse, for example. That's really very interesting. And so the things that you could control on the mannequin that would reflect on the ECMO machine. So they could talk to each other actually, because it was like almost like a real patient. I think that's what impressed me most. Unfortunately, sometimes when incidents happen, things can go really wrong, and sometimes they can cost the patient's life. So if the teams are very well prepared, then preventing these incidents in the first place or solving them efficiently, that could save patients' lives. We can't imagine a pilot flying a plane without being in the simulator. Even experienced pilots are forced to go to the simulator every year to keep their skills up, because some things don't happen every day, and you don't land on water every day, but you have to know how to do it. So, and with this technique like ECMO, that's a very advanced technique, it's the same. So we should practice, and I am convinced that if you have a team that can train in these simulators, when they go to real life, they will perform much better, and that will save patients' lives. Actually, from my part, was the simulations. I think my biggest learning, because it's not the first time we do this kind of courses, and we also do it back home. We built our own simulator with one of our nurses, and so I took a lot of things from what we can do with simulation, how far we can go with simulation. I think you are at a very, very high level with what you can do, and that was the thing that impressed me most. And then, of course, the level of the students, and we always learn from the students, different backgrounds and from all over the world. So we had people from Chile, Saudi Arabia, Abu Dhabi, and a lot of European countries. So that was really very good to me, the networking. It's a privilege, actually. It's a privilege. We came together with the very different, as the teachers, also very different backgrounds. So from a lot of different countries and a lot of different ECMO units, some with 30 years of experience and hundreds and hundreds of patients. Others like mine, not so old and not with as many patients. But I think we are a very good group. We do meetings every week, the whole year, to prepare for these courses. So we put a lot of efforts into this, and I think the students felt that, and that's why I think they liked it so much, because we really put an effort in this, and it's a privilege to be part of this amazing team. Definitely, yeah. I think this course, hopefully it will happen again. We plan to do it at least once a year. But I think compared to last year's course, this year, I think the level of the simulation was much, much higher. So we improved a lot. And so to be able to keep this level, I think it would be very good for the students and also for us.